Senator Harry Reid's health care bill, as you know, could head to a vote as early as Saturday. The Congressional Budget Office scored the latest version of the health care bill last night.
We all acknowledge this legislation is a tremendous step forward. Why? Because it saves lives, saves money, and protects Medicare, makes Medicare stronger.
Well, with me this morning from Washington is Bloomberg contributor Dr. Mark McClellan. He's a former administrator for Centers for Medicare and Medicaid, as well as commissioner of the Food and Drug Administration. And Mark, good to have you with us back on the program.
Good morning, Betty.
Of course, what do you make of this bill from Senator Reid?
Well, Senator Reid said it is a step forward. This is now going to probably go to consideration in the Senate. There's an important vote coming up on Saturday. My guess is that Senator Reid and the Democrats will get over that 60-vote hurdle to start consideration of legislation. This bill, Betty, is somewhere between a bill that the Senate Finance Committee produced back in September and the bill recently passed by the House of Representatives. It's a little bit more generous. It's got more in the way of a public option. It's got net costs that are about the same because it has a later start date. So it is another important step in the process of health care reform legislation.
Yeah, and the CBO came out and basically seemed to give some sort of a support, really, in his bill, particularly on the cost front. I mean, is that essentially going to be the win for Democrats to be able to get the votes?
That's certainly the way that they want this to be portrayed. It does save money, according to CBO, over the first 10 years. It saves more money over the next 10 years. The criticisms, Betty, will be, number one, it does that by starting later. The costs inside are still higher. Number two, it raises taxes from outside the healthcare system. So healthcare spending overall is still going up a bit. It's not going down. More needs to be done on that.
Yeah.
And number three, there are going to be concerns about how much of a role the government has and other new taxes play in this legislation. So it's still going to be a big fight ahead.
A big fight, and a fight around certain key issues, funding on abortion, the Medicare payrolls tax, the tax on Cadillac plans. I mean, what's going to have to be compromised here?
Those are all issues that are still very much on the table. Those are issues where the House bill and the Senate bill differ significantly. Often by this stage in the legislative process, you see the bills really coming together, more similarities, but there still is a lot to be worked out. And remember, this bill has still got to get through the Senate. There's still more work to do just to get it through the Senate, and it will probably change before that happens.
What's going to hold it up the most out of those, though? I mean, you know, abortion funding is just one of the small parts, but it certainly ignites a lot of passion.
Well, there are a number of issues here that ignite passion. The abortion issue, the Senate bill does differ from the bill that actually passed the House. It's less restrictive on the availability of plans that cover abortion. The issue of what the role of the public plan is, there are a lot of moderate Democrats who have not been supportive of the provision in the bill, and then there are overall concerns about spending and taxes.
Okay, Mark McClellan, thanks so much for talking to us about health care.